Thank you again so much for your time and your participating in the project Empathy. So I would start with first question. If you could please introduce us your project.
Yeah, good morning. So Empathy aims to evaluate and optimize proton arc therapy. As you know, proton therapy is a very novel or like targeted radiation therapy modality, and then now proton arc therapy, so rotational proton therapy is under development, and it will probably become like FDA cleared CE mark in maybe a couple of years. Conventional radiation therapy is already rotational. So rotational X-ray therapy has become the standard because it's fast, it's efficient, it provides superior dose distributions. However, for proton therapy, it's not that obvious because the main advantage of proton therapy is that it allows that a huge, like a large part of the body receives zero dose, right? So if now all of a sudden we are basically treating in a rotational way, basically this great advantage of proton therapy, we're getting rid of it. And of course, we get rid of it because it has other advantages, right? It could potentially become more efficient. It could potentially deliver superior dose distributions, and that the effect or like the side effects associated to this superior dose distribution compensate the fact that we are giving a low dose path to the patient. However, it's not so obvious. It's not so straightforward. And we believe that there is room to evaluate whether this is, you know, when are we going to use this technique, right? And so in Empathy, we decided to focus on what we believed is kind of the worst case scenario. So yes. Pediatric patients and brain tumors, right? So we decided to focus, of course, because we cannot study everything, to focus the project on this worst case scenario. And basically the project has one part of evaluation of the current technology, but then also it has the part of optimizing it. So as I said, is a technology under development. There is a lot of research going on. And so basically this is how we split also a bit between the partners and the work packages. There is one work package for evaluation using current technology and retrospective data. There is another big work package on optimizing this technology. How can we deliver better dose distributions, better optimization algorithms? How can we deliver faster, etc.? And then there's a third package, which is very important as well, is that nowadays a radiation therapy treatment it comes with a lot of imaging dose. And well, there's already a paper from PSI showing that, you know, even taking a CT every day, you know, like if you are able to adapt the plan on a daily basis from a daily CT, it's actually beneficial overall, even in risk of secondary cancer and so on. So basically, there is this huge imaging component where we also want to optimize. We know, I mean, daily imaging is a fact. Daily CT or daily Conbeam CT will become maybe routine as well. So we also deal with this part that we cannot just forget about imaging in radiation therapy nowadays.
Yes. Thank you. Can you describe your consortium and explain how you selected and engaged your partners?
Yeah. Well, that was actually very natural because we came up with the clinical question. So we are building a proton therapy center in Barcelona, in Catalonia, and we will get this technology. So we had this clinical question, like, when are we going to use this technology, especially for pediatric patients? And then we just, you know, like going through the Pianoforte partnership, and we realized, oh wow, there is KU Leuven there with Edmond Serpin, that they are leading optimization in this field. And then there was Dresden, with Christian Richter, that they are leading implementation of novel city technologies and so on. So it just, and then I know them in person, especially at Mons, because I was working in Leuven and they were already working together in other projects. So it was just, I mean, it was super easy. All of a sudden we fulfilled all the requirements that they had to be, one is a beneficiary, the other is affiliated, and we had one new partner. So it kind of, I mean, it was just like a bit of like magic. I mean, it was very easy and very obvious. And so far it has also been very, very good to work together.
Oh, perfect. Thank you. What key results do you expect from the project, and how do you foresee these outcomes impacting the EU community?
So what we expect to develop NTCP models for brain toxicity in pediatrics. That could be very helpful. There is some data already in Pentec, but we want to see if with a large data cohort we can validate or even develop some new models to basically to guide a clinical decision. We also want to develop a tool, decision support tool to decide when, I mean, based on quantitative metrics, to decide when to use arc therapy, proton arc therapy or not. We expect to develop novel optimization algorithms, so make proton arc therapy even better, being like capable of delivering better dose distributions. We also aim at coupling proton arc therapy and online adaptive, which is a major challenge. We expect to optimize CT protocols, in particular with photon counting CT. We see a lot of potential there. And overall, I mean, when you put all these like individual results together, the main goal of the project is to deliver kind of a standard protocol on how to use proton arc therapy for pediatric brain tumors.
I see. Thank you. And the last question, your project has been running, has just begun, as I believe.
Yeah.
So what initial outcomes do you anticipate from this collaboration?
Yeah,
now that your project is on the way, what results or impacts do you expect to emerge from this collaboration?
Well, as you said, our project kicked off end of March, so we have been like 4 months. So far we managed to hire all the research resources, let's say that we for the first year, and basically now we're kicking off. We're collecting data and going through ethics committees. We have a lot of things that we managed to clear, but we're still starting. We wouldn't have results yet. We're at the very early stage. But we anticipate maybe to able to tick a couple of tasks by the end of the first year. But right now I cannot tell you much more because we're really in a early stage.
That's understandable. You've just begun. I was just wondering. Thank you so much, Dr. Gomà. This is all.